So now that we've looked at the bladder, here's another scan performed by ultrasound fellow extraordinaire Melissa. This patient had a known history of bladder cancer, and looking at it now, we can see how different it is than the scan of that gentleman who had BPH. Instead of a small inferior mass with smooth borders, we have an irregular mass that appears to be covering every wall of the bladder except for the anterior portion. Most bladder cancers are epithelial and don't invade the submucosal layers, so what you get is a mass that starts to spread outwardly along the inner surface of the bladder rather than deep into the tissues. Melissa also did the thing that you should do when you see something wrong with the bladder, which is scan the kidneys. She started on the right and saw this obvious hydronephrosis. Just to review, hydronephrosis is dilatation of the renal collecting system caused by downstream blockage. On ultrasound, some people describe this as a bear claw. Both grade 1 and 2 are considered mild, and you get dilation of the renal pelvis first, and then the calyces if it's grade 2. For grade 3 or moderate hydronephrosis, you'll see a blunting of the fornices, which basically means the dilated area doesn't form these sharp little triangles anymore. With grade 4 or severe hydronephrosis, you get thinning of the cortex of the kidney. Looking at the right kidney again for this patient, you can see the dilated collecting system, but some preserved fornices, making this grade 2 almost grade 3. On the left side, we see that all the fornices have these rounded edges, making it grade 3 hydro, but you don't see thinning of the cortex yet. You can even see two parallel hyperechoic lines towards the inferior pole of the kidney, which are actually a stent that was in place. Overall, a great example of hydronephrosis and the likely etiology of obstruction in the bladder.